Most people bring a behavioral health care specialist and put them inside of a primary care setting. However, here at Valeo, we've actually brought the primary care clinic into the mental health center. Patients that usually engage our clinic are ones that have not necessarily been involved with primary care recently, so there's a lot of work to do. They oftentimes at their first visit come in with quite a list of concerns. So we just take that list, we decide what the priority concerns are going to be for that visit, and then we just work through them one by one.
I had a little thing going on with my stomach. It was like a dull pain. It was there like all the time. I was throwing up. Once I started taking the medication that my doc prescribed me, it just calmed down.
If you engage the patient in a way that they can understand the need for this care or why the medication will help or why behavior changes are necessary, then they're much more likely to buy in and participate in their physical health care. Recently, we've had a couple of patients where we've had a chance to look at their blood work over a period of time after we've implemented medication changes, and specifically cholesterol levels. When we had the chance to recheck them and look at those numbers in comparison, the patient can see that they've really made a big difference. Their total cholesterol's down, their bad cholesterol's down, their good cholesterol's up, and it's just simply by making some small changes and taking their medication as prescribed. And they have that tangible evidence that they're making a difference in their health.
If they can't do it here, they're gonna put you in with somebody that can't get it done. So try it. Let's try it for real. Like, listen to me. I'm hard-headed. I used to want to do me, but I got plugged in and I started listening, and they hooked me up with Doc Laura, and I'm cool.
One of the consumers I've had the opportunity to work with recently is a gentleman who was incarcerated for a very long time, more than 40 years. And so he had not been engaged into a traditional healthcare system his entire adult life. He was also released from prison without his medications, and so by the time he got to our clinic, he had significant needs to get back on his blood pressure medication and get some inhalers started to help his breathing status. Since his return visits, he's been very appreciative and expressed how grateful he is for our services here.
You go through one door, you get your screws tightened up, you go through another door, you get your heart right, and then you go through another door and you get all the medication to make it right. You know, how can you go wrong? I mean, come on. And you get treatment, you get the medication, but you also get care. You know, you get people who really care, and you can tell you how to be able to feel, the emotional connection there is between the people who work here.
Some of the things that I find most rewarding is seeing a patient go from not really knowing very much about their health and having some significant concerns to being very empowered and knowledgeable about their conditions and being able to then manage them on their own and feel very successful. And you can just see them lose weight and become healthier and make better choices, and they just come in, they're happier people. I think we really underestimate how much physical health plays into the stability of mental health and vice versa. We are mind, body, spirit, and we can't separate any of them from the others.